So, here we are in 2025, and while so much has changed, COVID-19 is still a part of our lives. But, and this is a big but, the virus we're dealing with today is not the same one from a few years ago. So, what's new? What's actually different? And what do you really need to know right now? Well, let's get right into it. I want to start with this quote: severe pain, as if their throat is covered with razor blades. Wow. Now, you might think that's from the early chaotic days of the pandemic, but it's not. This is a recent description from a patient. It's a really powerful reminder that this virus is still a moving target, constantly changing and throwing new challenges our way. Okay, to help make sense of everything, here's our game plan. First, we'll cover what COVID-19 looks like today. Then we'll dive into the symptoms and who's most at risk. After that, we'll talk about our best line of defense, our vaccine shield. And finally, we'll walk through all the options we have for control and treatment. All right, let's start with the big question. What is the state of COVID-19 in 2025? The short answer? It's complicated. Look, we've made some incredible progress, no doubt about it, but the virus is still here, and it is definitely not standing still. It's a persistent threat, and it's always evolving. Just so we're all on the same page, let's do a super quick review. The illness we call COVID-19 is caused by a virus named SARS-CoV-2. Now, while that name has stayed the same, the virus itself, it has been very, very busy changing. And how's it getting around? The fundamentals haven't really changed. It's still mostly an airborne thing, traveling in tiny droplets when people are close to each other. But here's the real kicker, the part that's always made this tricky. You can spread it without even knowing you have it. Asymptomatic spread is still a huge piece of the puzzle. Remember I said the virus is evolving? Well, here you go. Meet the new kids on the block. XFG, which they're calling Stratus, and NB.1.8.1, or Nimbus. These are the latest variants that have been driving the recent waves of infection. It's kind of like a constant cat-and-mouse game, tracking these new mutations as they pop up. This chart gives us a snapshot of the global situation, and you can see it's a real mixed bag. On one hand, globally, we're way, way down from the peak. That's great. But on the other hand, we're seeing these regional flare-ups. In just a one-month span, 37 countries in the Americas and Europe saw their cases go up. And in the US, that new XFG variant is the dominant strain in 19 states. So while the overall trend is good, we definitely can't let our guard down. Okay, let's move on. Knowing the virus is still out there, who is it affecting the most these days, and what exactly should you be looking for? So what are the telltale signs? A lot of these are the usual suspects, right? Cough, sore throat, fever, feeling totally wiped out. But don't be fooled. This virus can still throw some curveballs, like headaches, muscle aches, and even stomach issues. And yes, that infamous loss of taste or smell is still part of the mix for some people. Now, while anyone can catch this, some of us are absolutely at a higher risk of getting seriously ill. This includes the very young, babies under 6 months, and older folks, 65 and up. It also includes people who are unvaccinated. And of course, if you have an underlying health condition like heart disease, diabetes, or cancer, you really want to be extra careful. You know, the story doesn't always end with a negative test. For a lot of people, the battle with COVID continues for months or even longer. We're talking about long COVID. It can be a really debilitating condition with a whole range of symptoms, from constant fatigue and brain fog to serious heart problems. It's a really stark reminder that this virus can leave a lasting impact. Okay, now for some good news. We are not powerless here, not at all. We have an incredibly powerful weapon in our arsenal: vaccines. They are, without a doubt, our best defense against getting seriously sick, ending up in the hospital, or worse. So let's take a look at the latest lineup. So here's a rundown of the vaccines protecting us for the 2025-2026 season. You've got the cutting-edge mRNA vaccines from Moderna and Pfizer, plus Novavax, which uses a more traditional protein-based technology. The takeaway is this: for anyone 65 and over, getting your shot is pretty much a no-brainer. For younger people, it's especially important if you have any of those underlying health conditions. These vaccines are safe, they're effective, and they're a best bet for staying out of the hospital. So vaccination is our shield. Absolutely. But what happens if you think you've been exposed, or you actually start feeling sick? Let's walk through the modern toolkit we have for diagnosing, controlling, and treating COVID-19. Okay, you're not feeling so great. Is it just a cold? Maybe the flu? Or could it be COVID-19? The only way to know for sure is to get tested. When it comes to tests, you basically have two main options. The PCR test is the gold standard for accuracy. It's super reliable, but you do have to wait a little for the lab to process it. Then you have the rapid antigen test, which gives you an answer in minutes, right in your own home. Both are fantastic tools to have on hand. But testing is only one piece of this puzzle, right? All those simple things we learned at the very beginning of the pandemic are still just as important today. Wash your hands, cover your cough, keep some distance from people who are sick. And hey, if you're traveling or in a really crowded place, a mask is still a great idea. These simple habits can make a huge difference. Now, if you do catch a mild case, treatment is all about supportive care at home. That just means using over-the-counter medicines for your symptoms, and most importantly, getting plenty of rest and fluid so your body can fight it off. If a case is severe enough to land someone in the hospital, the good news is that doctors have a whole arsenal of treatments. They can use things like oxygen, powerful antiviral drugs, and steroids to help with breathing and reduce inflammation. For people with weakened immune systems, there's even convalescent plasma. It's really a testament to how far medical science has come. And just in case you think this problem has gone away, check out this number, 65. That's how many countries reported new cases of COVID-19 in just a 1-month period this year. That's a huge number, and it's a powerful reminder that we're all still in this together. It's a global challenge, and it needs a global response. So where does that leave us? Well, the one thing we know for sure is that this virus will keep changing. It will continue to surprise us. But we're not starting from scratch anymore. We have the knowledge, we have the tools, and we have the experience to face whatever comes next. The real question is, how will we adapt and use them? Because our health, collectively, depends on it.